सत श्री अकाल स्वागत है तुहाडा सारिਆਂ ਦਾ ਹੈਡਲਾਈਨ ਕੈਨੇਡਾ ਦੇ ਵਿੱਚ ਮੈਂ ਹਾਂ ਰੁਪਿੰਦਰ ਕੌਰ ਕੈਨੇਡਾ ਤੋਂ ਕੋਵਿਡ-19 ਅਪਡੇਟਸ ਦੇ ਨਾਲ ਅਸੀਂ ਇੱਕ ਵਾਰੀ ਫੇਰ ਤੋਂ ਹਾਜ਼ਰ ਹਾਂ ਕੈਨੇਡਾ ਵਿੱਚ ਕੋਵਿਡ-19 ਕੇਸਿਸ ਦਾ ਅੰਕੜਾ 88,000 ਤੋਂ ਉੱਪਰ ਹੋ ਚੁੱਕਾ ਹੈ ਇਸ ਦੇ ਨਾਲ ਹੀ ਬੀਤੇ ਦਿਨੀ ਪ੍ਰਾਈਮ ਮਿਨਿਸਟਰ ਦੀ ਵੱਖ-ਵੱਖ ਸੂਬਿਆਂ ਦੇ ਪ੍ਰੀਮੀਅਰਸ ਨਾਲ ਖਾਸ ਮੀਟਿੰਗ ਹੋਈ ਹੋਰ ਕੀ ਕੁਝ ਰਿਹਾ ਖਾਸ ਐਸੇ ਤੇ ਰਹੇਗੀ ਨਜ਼ਰ ਅੱਜ ਹੈਡਲਾਈਨ ਕੈਨੇਡਾ ਦੇ ਵਿੱਚ प्राइम मिनिस्टर जस्टिन ट्रूडो ने एक बार फिर तो नेशन ਨੂੰ ਐਡਰੈਸ ਕੀਤਾ ਤੇ ਜਾਣਕਾਰੀ ਦਿੱਤੀ ਕਿ ਬੀਤੇ ਦਿਨੀ ਪ੍ਰਾਈਮ ਮਿਨਿਸਟਰ ਦੀ ਵੱਖ-ਵੱਖ ਸੂਬਿਆਂ ਦੇ ਪ੍ਰੀਮੀਅਰਸ ਨਾਲ ਖਾਸ ਮੀਟਿੰਗ ਹੋਈ ਜਿਸ ਦੇ ਵਿੱਚ ਕੈਨੇਡੀਅਨ ਆਰਮਡ ਫੋਰਸਿਸ ਵੱਲੋਂ ਪੇਸ਼ ਕੀਤੀ ਗਈ ਲੌਂਗ ਟਰਮ ਕੇਅਰ ਦੀ ਰਿਪੋਰਟ ਸੰਬੰਧੀ ਚਰਚਾ ਹੋਈ ਉਹਨਾਂ ਵੱਲੋਂ ਭਰੋਸਾ ਦਿੱਤਾ ਗਿਆ ਕਿ ਕਿਸੇ ਵੀ ਸੂਬੇ ਨੂੰ ਜਦੋਂ ਫੈਡਰਲ ਸਰਕਾਰ ਦੀ ਲੋੜ ਹੋਏਗੀ ਤਾਂ ਸਰਕਾਰ ਉਹਨਾਂ ਲਈ ਹਾਜ਼ਰ ਰਹੇਗੀ
From day one, our government has been working with the provinces and territories to keep Canadians safe and address this pandemic. And this morning, I want to begin with an update on where this work stands. Yesterday, the Premiers and I, along with Deputy Prime Minister Freeland, had our 11th First Ministers' meeting since this crisis began. We discussed the very concerning reports regarding certain long-term care homes in Ontario and Quebec. What the Canadian Armed Forces reported is deeply disturbing. That any senior would face this kind of treatment is unacceptable. But as I said to the Premiers, our government will be there to support them as we work together to ensure that our elders receive the care they deserve. In our meeting, we also talked about what we need to do together to help businesses reopen and get people back on the job while keeping our communities safe. Moving forward, it will become even more important to quickly identify and then isolate this virus. To do that effectively, we need to coordinate across the country. A number of provinces have already reached out to us for support on contact tracing, and our governments are currently working together on a data sharing platform. And yesterday, First Ministers were briefed on the work being done by the COVID-19 Immunity Task Force, which will coordinate blood test surveys across Canada. The Premiers and I also spoke about support for workers during this difficult time. Our government will continue discussions with the provinces on ensuring that as we enter the recovery phase, every worker in Canada has 10 days of paid sick leave a year, because no one should have to choose between taking a day off sick and paying their bills.
ਇਸ ਦੇ ਨਾਲ ਹੀ ਪ੍ਰਧਾਨ ਮੰਤਰੀ ਵੱਲੋਂ ਇੰਡੀਜਨਸ ਲੋਕਾਂ ਲਈ ਖਾਸ ਤੌਰ ਤੇ $650 ਮਿਲੀਅਨ ਦਾ ਐਲਾਨ ਕੀਤਾ ਗਿਆ ਹੈ ਜੋ ਖਾਸ ਤੌਰ ਤੇ ਹੈਲਥ ਕੇਅਰ ਅਤੇ ਵਿਮਨ ਸ਼ੈਲਟਰ ਲਈ ਖਰਚੇ ਜਾਣਗੇ
This morning, I can announce that we are investing $650 million to support Indigenous communities on healthcare, income support, and new shelters for women. Let me start with the first pillar, which is healthcare. Although we've made progress, there are still communities that are not properly equipped to handle a COVID-19 outbreak, and we need to address that. That's why we're investing over $285 million for public health in First Nations, Inuit, and Métis communities. These funds will go toward more nurses, will help procure specialized supplies, and will support work with First Nations, Inuit, and Métis communities on continued community-driven responses. Having the right health care is essential, but it isn't the only concern facing communities right now. Because of this pandemic, a lot of people also need a hand in paying for the basics. So, as a second pillar of this investment, we are boosting the On-Reserve Income Assistance Program. This money will support people living on reserve who need help paying for things like groceries, cleaning supplies, or rent. A portion of this funding will also help First Nations communities continue to provide services like skills training and support for people as they navigate federal benefits. The work being done in communities by members of the communities is incredibly important to help people get through this very challenging time. And that brings me to the third pillar of this funding, investment in shelters. In April, we announced $10 million so that emergency shelters for Indigenous women and children could adapt to the new challenges posed by COVID-19. This is vital support in the short term. But in the long term, more still needs to be done. So today I can announce that our government is investing an additional $85 million for new shelters for Indigenous women. These shelters will be built in communities across the country, including in the north. No one should have a place to stay when they're unsafe. No one should have a place to stay. No one should have to stay in a place where they're unsafe. No one should be forced to choose between violence or homelessness. These new shelters will offer a path forward when people need it most.
ਫੈਡਰਲ ਸਰਕਾਰ ਵੱਲੋਂ ਪਰਿਵਾਰਾਂ ਲਈ ਕਈ ਤਰ੍ਹਾਂ ਦੇ ਬੈਨੀਫਿਟ ਦਾ ਐਲਾਨ ਕੀਤਾ ਗਿਆ ਹੈ, ਪਰ ਕੀ ਕੀਤਾ ਜਾ ਰਿਹਾ ਹੈ ਸੀਨੀਅਰਸ ਲਈ? ਕਿਉਂ ਸੀਨੀਅਰਸ ਦੀ ਹੈਲਥ ਕੇਅਰ ਲਈ ਇੱਕ ਯੂਨੀਵਰਸਲ ਫਰੇਮਵਰਕ ਤਿਆਰ ਨਹੀਂ ਕੀਤਾ ਜਾ ਰਿਹਾ? ਐਸੇ ਸੰਬੰਧੀ ਗੱਲਬਾਤ ਕਰਦੇ ਹਾਂ ਮਿਨਿਸਟਰ ਆਫ ਫੈਮਲੀਜ਼, ਚਿਲਡਰਨ ਐਂਡ ਸੋਸ਼ਲ ਡਿਵੈਲਪਮੈਂਟ ਅਹਿਮਦ ਹੁਸੈਨ ਦੇ ਨਾਲ।
Minister, we would like to know, looking at the reports of CAF on long-term care, they are horrified, they are disturbing. We know now the premiers are stepping up and provincial government is taking actions. But why don't federal government announce one universal framework for senior care?
Well, first of all, I just want to begin by saying that the reports that we have received from the Canadian Armed Forces members who have documented really serious issues happening in the long-term care facilities is very, very shocking, is unacceptable the way those residents have been treated. I mean, anyone who has read those reports can only be shocked and disappointed by what we've seen. We expect our senior citizens to be treated much better with respect and dignity, and what we've seen is really far away from that. We will do whatever we can to work with provinces and territories to make sure that we're there for our seniors. There is a jurisdictional issue here whereby the provinces are responsible for seniors and long-term care facilities, but our job is to support the provinces, and we are continuing to do that. Right at the beginning of the pandemic, we provided $500 million to provinces and territories to shore up their healthcare system so that it can be resilient, and we will continue to work with them. There's a very close collaboration between our government and all the provincial governments and territories on all these issues, including issues related to seniors.
Minister, this month families have received a benefit of $300 per child. Thank you so much. But this is one. So, will there gonna be any further increase in the amount what we receive monthly?
Yes. So on May 20th, you saw the one-time increase of $300 per child for each family that is receiving the Canada Child Benefit. That will go a long way to help many families. In addition to that, on July the 20th this year, we will see another increase in the Canada Child Benefit to take into account the increase in the cost of living. This is the third year in a row in which we will be increasing the Canada Child Benefit to take into account the rise in the cost of living, so that families can be in a better position and meet the expenses of raising children.
According to Stats Canada, millions have lost their jobs and millions have applied for the benefit for the CERB. Whenever there is a loss of job or a financial crisis, we always see it impacts mental health and family. Being the Minister of Family and Social Development, are you worried about its impact on families' social structure?
Oh, absolutely, of course. And we have, from the very beginning of this pandemic, we have been there for families. We've been there for children. We've been there for Canadian workers. We moved very quickly to establish the Canada Emergency Response Benefit for all those people who've lost their jobs or who've been laid off from their job or whose job has simply disappeared. And that's $2,000 a month for 4 months that's going into the pockets of Canadian workers who need help now. And our government moved very quickly to provide that help. In addition to that, we introduced the Canada Emergency Wage Subsidy to pay 75% of the wages of the employees of businesses who apply to the Canada Emergency Wage Subsidy. That's up to $847 a week for each Canadian worker who needs that help. That's a big help to Canadian businesses and nonprofit organizations that are trying to keep their employees working or rehire employees that they just laid off. So In terms of support for families, we already talked about the increase in the Canada Child Benefit. But in addition to that, we've also delivered supports in the form of an increase to the GST tax credit, $400 additional dollars for single people and $600 for couples. And we will continue to be there for families throughout this pandemic.
But there are many residents who don't have jobs and don't qualify for benefits. So are you worried about them? Always these cases, they have mental impact on them.
Yes, of course. I mean, for the CERB and the Canada Emergency Wage Subsidy cover a lot of people. But having said that, we do always recognize that there's some people who don't meet those eligibility requirements. And that is why we heard from students, for example, students who didn't qualify to get the CERB or the CEWS. And so what we've done is we've introduced the Canada Emergency Student Benefit to provide students some support to get them back to a good state before they go back to school in September. And we've also introduced the Canada Service Grant, so to support students who are working in the community, to give them a grant of up to $5,000, a scholarship of $5,000, so that they can have a little bit of money to go back to school with. In addition to that, we're providing a little bit more money under the Canada Emergency Student Benefit to students who have dependents or who have a disability. So we're there for students as well. In addition to that, for folks that you've talked about who are going through some real challenges, mental health challenges and other needs, we have provided $350 million to establish an emergency community support fund that will help organizations that are providing help to folks who are going through difficulties at this time.
Minister, any further challenges, issues, or concerns which you have identified and your department and you are planning to address going forward?
I think we just have to keep being there for Canadian families. We have to keep being there for Canadian seniors. We will continue to monitor the situation, and we will see what other gaps need to be dealt with. We are hopeful that as we get into the reopening phase, that our economy will bounce back very quickly because of all the supports that we've put in place. And we are hopeful that the Canadian economy will bounce back and Canadian businesses will come back strong.
Well, Minister, thank you so much for being up for PC and talking about all these important issues and concerns. Thank you so much and stay safe.
Thank you. It's a pleasure to be here. Thank you.
ਹੈਡਲਾਈਨ ਕੈਨੇਡਾ ਵਿੱਚ ਫਿਲਹਾਲ ਸਮਾਂ ਹੋ ਗਿਆ ਇੱਕ ਬ੍ਰੇਕ ਦਾ। ਬ੍ਰੇਕ ਤੋਂ ਬਾਅਦ ਸਾਡੀ ਇਹ ਖਾਸ ਪੇਸ਼ਕਸ਼ ਜਾਰੀ ਰਹੇਗੀ। ਤੁਸੀਂ ਬਣੇ ਰਹੋ ਸਾਡੇ ਨਾਲ। ਬ੍ਰੇਕ ਤੋਂ ਬਾਅਦ ਇੱਕ ਵਾਰੀ ਫਿਰ ਤੋਂ ਤੁਹਾਡਾ ਸਵਾਗਤ ਹੈ। ਰੁਕ ਕਰਦੇ ਹਾਂ ਓਨਟਾਰੀਓ ਦਾ। ਓਨਟਾਰੀਓ ਦੇ ਪ੍ਰੀਮੀਅਰ ਡਗਫੋਰਡ ਨੇ ਅੱਜ ਇੱਕ ਵਾਰੀ ਫਿਰ ਤੋਂ ਮੀਡੀਆ ਐਡਰੈਸ ਕੀਤਾ। ਨਾਲ ਹੀ ਉਹਨਾਂ ਜਾਣਕਾਰੀ ਦਿੱਤੀ ਕਿ ਜਿਸ ਤਰ੍ਹਾਂ ਇਕੋਨਮੀ ਨੂੰ ਗ੍ਰੈਜੂਅਲੀ ਰੀਓਪਨ ਕੀਤਾ ਜਾ ਰਿਹਾ ਹੈ, ਉਸੇ ਤਰ੍ਹਾਂ ਟੈਸਟਿੰਗ ਦਾ ਵੀ ਨੈਕਸਟ ਫੇਸ ਐਲਾਨਿਆ ਜਾ ਰਿਹਾ ਹੈ ਤਾਂ ਜੋ ਜਲਦ ਹੀ ਇਸ ਵਾਇਰਸ ਨੂੰ ਡਿਟੈਕਟ ਕਰਕੇ ਸਪਰੈਡ ਹੋਣ ਤੋਂ ਰੋਕਿਆ ਜਾ ਸਕੇ।
Today we released the next phase of our expanding testing strategy. We're working around the clock to get more people tested across the province. We're going into all sorts of hotspots. We're encouraging people to get tested. And we're also proactively looking for cases. We've started proactive testing of hospital staff, long-term care residents and staff, correctional workers and inmates, and essential workers. We're also proactively testing vulnerable populations and the staff who care for them in group homes, shelters, emergency child care centers, and other congregate settings. We're getting mobile testing teams up and running. These mobile testing teams will be rapidly deployed to hotspots across Ontario to help deal with any outbreaks. And I'll repeat it again, if you have COVID-19 symptoms, if you're worried, you've been in contact with someone with COVID-19, if you or your family are worried about exposure, in short, if you feel you need a test, please go get a test.
ਓਨਟਾਰੀਓ ਸੂਬੇ ਵੱਲੋਂ ਵੱਖ-ਵੱਖ ਬਿਜ਼ਨਸ ਨੂੰ ਰੀਓਪਨ ਕਰਨ ਲਈ ਕਈ ਗਾਈਡਲਾਈਨਸ ਇਸ਼ੂ ਕੀਤੀਆਂ ਗਈਆਂ ਨੇ ਤੇ ਵੱਖ-ਵੱਖ ਬਿਜ਼ਨਸ ਵੱਲੋਂ ਇਹਨਾਂ ਗਾਈਡਲਾਈਨਸ ਨੂੰ ਫੋਲੋ ਵੀ ਕੀਤਾ ਜਾ ਰਿਹਾ ਹੈ। ਗੱਲਬਾਤ ਕਰਦੇ ਹਾਂ ਇਨਫਿਨਿਟੀ ਡਾਊਨਟਾਊਨ ਦੇ ਜਨਰਲ ਮੈਨੇਜਰ ਦਿਮਿਤਰੀ ਪ੍ਰੈਸਮੈਨ ਦੇ ਨਾਲ ਤੇ ਜਾਣਨ ਦੀ ਕੋਸ਼ਿਸ਼ ਕਰਦੇ ਹਾਂ ਕਿ ਉਹਨਾਂ ਦੀ ਡੀਲਰਸ਼ਿਪ ਵਿੱਚ ਹੈਲਥ ਗਾਈਡਲਾਈਨਸ ਨੂੰ ਕਿਵੇਂ ਫੋਲੋ ਕੀਤਾ ਜਾ ਰਿਹਾ ਹੈ। Hello and thank you so much for taking out time for PTC.
Hello, thank you for having me.
We would like to know, as the offices are now open after a temporary shutdown, so how is the new look of the office after this reopening?
So it is a little bit different than what it was before, obviously. We have all safety measures in place according to Canada Health. We always keep the distance of 6 feet. Everybody in the dealership is wearing masks. We have one customer at a time for service drop-off. We try to do everything touchless as much as possible. And we clean and wipe everything down as many times as necessary.
And how do you make sure your staff and the customers who are entering in, they are following the health guidelines?
Well, what we do is we ask the customers if they feel well. That's the first questions, if everything is okay, if they haven't been exposed to anybody. And then we obviously monitor and ask the customer if they are wearing masks or if they would like a mask. We're also asking how many people have been in their car before, etc. And then they walk into the dealership. Depending on which side, we have a separate service entrance and a separate sales entrance.
During the temporary shutdown, we noticed that many dealerships, they have laid off their staff, but now they have called back. What happened exactly in your dealership? Did you laid off your staff and have you called them back?
We were impacted the same way as everybody else. And we did call most of our employees back to the dealership. And the ones that we haven't called yet, we are looking forward to calling them back soon.
And do you think the federal benefits, the benefits which have been announced by the government to help the businesses, they will help you to survive in the long run?
I certainly hope so. Yes, I do think it is working. But I do also think that it is a different business model going forward. Customers will behave different. People will look different at things, how they buy it and how much time they're spending, etc. And I think that a lot will be online instead of walk-ins that we saw before in dealership.
And whoever is coming to buy the car, the customers, they want to do the test drive. So we just want to know, is the test drive allowed during this time?
So the test drive is allowed during this time. We are asking the customers if they feel comfortable going on a test drive with somebody or by themselves. If they ask us and if they tell us that they are comfortable of going to a test drive with a salesperson, what we do is the salesperson sitting in the back of the car at the rear seat, not at the front. Obviously also with a mask and everything that needs to be done. If the customer is not comfortable of taking the test drive with a salesperson, we have the customer go by themselves. What we do is we establish a Bluetooth connection in the car so that we can talk to the customer while they are driving. And if they have any questions, we can always respond to them.
And if the customer is taking the test drive, or if they are viewing the car, they are getting inside, do you make sure that car is properly sanitized?
Every time when a customer returns a car, a test drive vehicle, or a customer car comes in for service, we wipe down all the touch points. Furthermore, we also put plastic seat covers and steering wheel covers on the vehicle itself after we wipe it down.
Would you like to give any message for your customers who want to come in and have a look at the cars? Because
Yes,
they have that fear in the mind that it won't be comfortable or they could get exposed.
We are here to serve our customers, and we're very happy to welcome them back. If they're not comfortable coming in, we understand that. They can reach out to us. We have a website, which is Infinity Downtown, Nissan Downtown, and Avenue Nissan. And on that website, they can actually even purchase a car from start to finish. We can also call them and guide them through it. Whatever a customer would like to see, we are here to help.
Well, thank you so much for taking out your time and talking to us. Thank you so much and stay safe.
Thank you very much. Same to you.
ਸੋ ਹੈਡਲਾਈਨ ਕੈਨੇਡਾ ਵਿੱਚ ਬਸ ਇੰਨਾ ਹੀ। ਫਿਲਹਾਲ ਸਾਨੂੰ ਦਿਓ ਇਜਾਜ਼ਤ। ਤੁਸੀਂ ਰੱਖੋ ਆਪਣਾ ਖਿਆਲ ਤੇ ਦੇਸ਼ ਦੁਨੀਆ ਦੀਆਂ ਖਬਰਾਂ ਲਈ ਬਣੇ ਰਹੋ PTC ਦੇ ਨਾਲ।